Welcome back, future nurses. You have just reached practice test 15 of our ultimate NCLEX prep series. And if you have made it this far, you are already proving your dedication, discipline, and drive to succeed. This test is specially designed to sharpen your critical thinking, strengthen your test-taking strategy, and reinforce the most high-yield nursing content you need to pass the NCLEX with confidence. In today's session, you will encounter a wide range of question styles, from priority setting and pharmacology to delegation, safety, and patient teaching. Each question will come with a detailed rationale that explains the core concept, breaks down every option, and teaches you how to avoid common traps on the real exam. So grab your pen, notebook, and focus, because we are about to challenge your knowledge and elevate your clinical judgment skills to the next level. And do not forget, every practice question brings you one step closer to RN success. Let us dive right into practice test 15 and show the NCLEX who is boss. Let us dive into question 1. A nurse is caring for a client newly diagnosed with bipolar disorder who is currently experiencing a manic episode. Which of the following nursing interventions is most appropriate? Here are the options. A. Encourage group activities to improve social interaction. B. Provide a low-stimulation environment with structured routines. C. Offer detailed explanations about unit rules and expectations. D. Allow the client to skip meals if they are not hungry. The correct answer is B. Provide a low-stimulation environment with structured routines. Let's break it down. Option B, correct. During a manic episode, clients often experience heightened energy, distractibility, and impulsivity. A low-stimulation environment with predictable routines helps reduce environmental triggers, prevent escalation, and promote safety. Question 2. A nurse is assessing a client in an inpatient psychiatric unit who states, "The government has installed cameras in my home and watches me all the time. How should the nurse best respond to this client?" The options. A. There is no way the government would do that to you. B. You are safe here. And I do not see any cameras. But I understand that this feels real to you. C. Why would the government want to spy on you? D. You need to stop thinking that way. It is not healthy. The correct answer, B. You are safe here, and I do not see any cameras. But I understand that this feels real to you. C. The rationale. This response uses therapeutic communication and is appropriate for a client experiencing a delusion of persecution. It does not validate the delusion, but it also avoids confrontation or arguing. Instead, it focuses on safety, reality orientation, and empathy, which helps build trust and reduces anxiety in the client. Question 3. Let us now review a key discharge teaching point for a client who just received a permanent pacemaker. The nurse should provide safety instructions to prevent device interference. The question is, which of the following instructions should the nurse include? The options are: Option A, avoid air travel because airport security equipment can interfere with the pacemaker. Option B, discard radios at home that contain antennas to prevent electromagnetic disruption. Option C, refrain from undergoing computed tomography scans due to device incompatibility. Or Option D, use a cellular phone on the side opposite the location of the pacemaker generator. The correct answer is Option D. Using the phone on the opposite side helps minimize electromagnetic interference with the pacemaker. Question 4. Let us shift our focus to pregnancy and dental care, a topic often overlooked but very important for maternal health. A prenatal client at 4 months gestation reports gingivitis and asks the nurse whether she can go ahead with a planned tooth extraction next month. The question is, what is the most appropriate information for the nurse to provide? The options are: Option A, the second trimester is generally the safest time for dental extractions during pregnancy. Option B, all dental extractions should be delayed until after delivery to protect the fetus. Option C, it is preferable to wait until the third trimester to reduce procedural risk. Or Option D, antiviral medications should be taken before dental procedures to prevent infections. The correct answer is Option A. Dental procedures like extractions are safest during the second trimester, typically between weeks 13 and 28, because the risk of teratogenicity is lower and the mother is generally more comfortable. Question 5. Now let us look at a common viral condition and its management. The nurse is caring for a client experiencing an active outbreak of herpes simplex virus. The question is, Which medication does the nurse anticipate the primary healthcare provider will prescribe to manage the condition? The options are Option A, metronidazole, Option B, acyclovir, Option C, imiquimod, or Option D, remdesivir. The correct answer is Option B, acyclovir. This antiviral medication is effective in managing herpes simplex virus outbreaks, especially when initiated at the first sign of symptoms such as tingling, itching, or burning. It helps reduce the severity and duration of symptoms and is also used for long-term suppressive therapy in clients with frequent recurrences. Question 6. Let us now turn to a critical skill in airway management, suctioning a tracheostomy to maintain patency. The nurse is caring for an adult client with a tracheostomy who requires suctioning. The question is, which action reflects proper suctioning technique that minimizes harm and ensures effectiveness? The options are Option A, select a 16 French suction catheter to maximize secretion removal. Option B, withdraw the suction catheter slightly, about 1 to 2 centimeters, before applying suction. Option C, apply continuous suction at 160 millimeters of mercury while withdrawing the catheter. Or Option D, apply suction for up to 25 seconds during catheter removal to fully clear the airway. The correct answer is Option B. When resistance or a cough is felt, withdrawing the catheter slightly by 1 to 2 centimeters before applying suction helps avoid damage to the tracheal wall and reduces the risk of mucosal injury. Suction should then be applied intermittently during catheter withdrawal. Are you ready to finally conquer the NCLEX and become the nurse you have always dreamed of? This all-in-one course has everything you need to succeed. You will get live classes with expert educators, over 100 hours of animated crash course content, and 500 hours of recorded lectures that you can watch anytime. We break down 500 next-generation NCLEX questions in detailed video discussions. Plus, you will get access to 5,000 real NCLEX questions from past exams. Want to practice like it is the real thing? You will also receive 15 full-length CAT and mock tests. But that is not all. This course includes an exclusive NCLEX ebook, PDF notes for quick revision, and personalized study planners for 1 week, 1 month, or 3 months. Whatever fits your schedule. And the best part? You get 1 full year of unlimited access after you enroll. Whether you are just starting out or doing a final review, this course is your shortcut to NCLEX success. So do not wait. Enroll now at website link and take the first step toward becoming a licensed nurse today. Question 7. Let us now shift to a pediatric emergency scenario where early action is crucial. A child arrives at the emergency department with a high fever, neck stiffness, photophobia, and a purpuric rash. The question is, what is the nurse's immediate priority intervention? The options are Option A, begin a tepid sponge bath to reduce fever. Option B, place the child on droplet precautions to prevent transmission. Option C, prepare the child for immediate lumbar puncture for cerebrospinal fluid analysis. Or Option D, arrange for a computed tomography scan of the brain to assess for swelling. The correct answer is Option B. These symptoms strongly suggest bacterial meningitis, which is highly contagious. Therefore, the top priority is to immediately initiate droplet precautions to prevent the spread of infection to others. Question 8. Next, let us focus on postoperative care and preventing a serious complication, venous thromboembolism. The nurse is caring for a client recovering from surgery who is at risk for venous thromboembolism. The question is, which medication would most appropriately be prescribed to prevent this complication? The options are Option A, enoxaparin, Option B, verapamil, Option C, tranexamic acid, or Option D, aspirin. The correct answer is Option A, enoxaparin. This low molecular weight heparin is administered subcutaneously and is commonly used for postoperative venous thromboembolism prevention. It effectively reduces the risk of deep vein thrombosis and pulmonary embolism without requiring frequent coagulation monitoring. Question 10. Let us now explore a case related to learning challenges in children. The nurse is evaluating a 10-year-old child who is having academic difficulties, specifically with reading, interpreting words, letters, and symbols. However, the child shows normal intelligence in other areas. The question is, which condition is the child most likely experiencing? The options are Option A, phonologic processing deficit, Option B, dyslexia, Option C, Tourette syndrome, or Option D, apraxia. The correct answer is option B, dyslexia. This is a specific learning disorder that impairs the ability to read and process written language, even though intelligence remains intact. Children with dyslexia often benefit from specialized educational support to build reading skills effectively. Question 11. Let us now review a lab interpretation scenario related to endocrine disorders. The nurse is reviewing laboratory results for a client who was recently diagnosed with hyperparathyroidism. The question is, which of the following findings would the nurse expect to observe? The options are option A, potassium 4.1 milliequivalents per liter, which is within normal limits. Option B, phosphorus 4.9 milliequivalents per liter, which is elevated. Option C, calcium 11.2 milligrams per deciliter, which is elevated. Or option D, sodium 132 milliequivalents per liter, which is low. The correct answer is option C, an elevated calcium level of 11.2 milligrams per deciliter. This finding is expected in hyperparathyroidism due to excess parathyroid hormone, which increases bone resorption and decreases renal excretion of calcium. Question 12. Now let us turn to a pediatric emergency that is both alarming for families and critical for nurses to manage appropriately: febrile seizures. The nurse is caring for a toddler who is currently experiencing a febrile seizure. The question is, what is the nurse's immediate priority action to promote safety during this event? The options are option A, review the child's complete blood count results. Option B, place the child on nothing by mouth status. Option C, insert an indwelling urinary catheter. Or option D, ensure suction equipment is readily available at the bedside. The correct answer is option D. During a seizure, the primary nursing priority is safety, and having suction equipment at the bedside ensures that the child's airway can be cleared if needed once the seizure ends. Question 13. Let us now examine a critical condition often seen after spinal cord injury: neurogenic shock. The nurse is assessing a client who recently sustained a spinal cord injury and suspects the client may be developing neurogenic shock. The question is, which clinical finding would best support this diagnosis? The options are option A, evidence of respiratory acidosis on arterial blood gas analysis. Option B, weak, thready peripheral pulses. Option C, profuse diaphoresis noted on skin assessment. Or option D, increased urinary output over several hours. The correct answer is option B, weak, thready peripheral pulses. This finding is a classic feature of neurogenic shock, which results from a loss of sympathetic tone and leads to widespread peripheral vasodilation, hypotension, bradycardia, and decreased vascular resistance. Question 14. Let us now explore lifestyle recommendations for a client with sickle cell disease aiming to avoid a sickling crisis. The client is seeking advice on safe leisure activities. The question is, which activity would be most appropriate for the nurse to recommend? The options are option A, hiking overnight at high altitude in the mountains. Option B, snow skiing in cold weather for an extended weekend. Option C, riding a snowmobile in sub-zero temperatures. Or option D, taking a drive to enjoy a picnic at the beach in warm weather. The correct answer is option D, taking a drive to enjoy a picnic at the beach in warm weather. This calm and relaxing activity avoids common triggers of sickling episodes, such as cold exposure, hypoxia, dehydration, or intense exertion. Question 15. Now let us look at pediatric care planning for a child with neuromuscular challenges. The nurse is developing a care plan for a 5-year-old child diagnosed with cerebral palsy. The question is, which intervention would best promote mobility and help prevent joint contractures in this child? The options are option A, encourage prolonged periods of rest to avoid fatigue. Option B, promote participation in strenuous exercise to build muscle strength. Option C, implement a daily schedule of stretching and range of motion exercises. Or option D, administer muscle relaxants regularly to improve mobility. The correct answer is option C, implementing a daily schedule of stretching and range of motion exercises. These exercises are essential in maintaining joint flexibility, preventing contractures, and supporting mobility. If you are feeling overwhelmed with NCLEX prep, just remember this: success does not come from studying harder, it comes from studying smarter. Our NCLEX Complete course is designed to give you everything you need in one place. Join live classes led by expert nurses, dive into 100 hours of animated crash course content, and access 500 hours of recorded lectures whenever you want. We guide you through 500 next-generation NCLEX questions and give you access to 5,000 previously asked NCLEX questions to build real exam confidence, with 15 full-length CAT and mock tests, a powerful NCLEX ebook, PDF notes, and study planners tailored for 1 week, 1 month, or 3 months. This course is your key to mastering every topic. Best of all, you get 1 year of full access. You have the potential, we have the system. Enroll now, and let us cross the finish line together. Question 16. Now let us move on to post-procedure care for dermatologic diagnostics. The nurse is caring for a client who has just returned from a circular skin punch biopsy, performed to evaluate a suspicious lesion. The question is, what should the nurse prioritize when monitoring the biopsy site immediately post-procedure? The options are: Option A, signs of wound dehiscence; Option B, early indicators of infection; Option C, evidence of bleeding at the site; or Option D, development of localized swelling. The correct answer is Option C, evidence of bleeding at the site. Since a punch biopsy removes a small core of skin, capillary or small vessel bleeding can occur, especially with larger specimens, or if the client is on anticoagulant therapy. This makes bleeding the most immediate and important complication to watch for. Question 17. Let us now turn to an emergency situation involving toxicology and rapid assessment. A client arrives in the emergency department following an intentional overdose of Nortriptyline. The question is, which piece of information is most critical for the nurse to obtain during the initial assessment? The options are: Option A, the exact number of pills ingested; Option B, the reason Nortriptyline was prescribed; Option C, history of prior suicide attempts; or Option D, circumstances leading to the overdose. The correct answer is Option A, the exact number of pills ingested. Nortriptyline is a tricyclic antidepressant, and overdoses can rapidly lead to dangerous cardiac arrhythmias and central nervous system depression. Knowing the quantity ingested helps determine toxicity risk and guides urgent treatment decisions. Question 18. Now let us focus on a classic communication feature often observed in clients with schizophrenia. During a mental health assessment, the nurse notes that a client is using made-up words and phrases that have meaning only to them. The question is, what speech pattern is the nurse observing? The options are: Option A, clang associations; Option B, alogia; Option C, neologisms; or Option D, tangentiality. The correct answer is Option C, neologisms. This refers to invented words or expressions that hold personal meaning for the client but are not recognized by others. Neologisms are a positive symptom of schizophrenia and are indicative of disorganized thought patterns. Question 19. Let us now look at a life-threatening scenario involving hypovolemic shock from internal bleeding. The nurse is caring for a client with suspected hypovolemic shock due to severe intra-abdominal hemorrhage. The client presents with tachycardia, hypotension, and a thready pulse. The question is, which blood product does the nurse anticipate the healthcare provider will order to stabilize the client? The options are: Option A, packed red blood cells; Option B, platelets; Option C, granulocytes; or Option D, fresh frozen plasma. The correct answer is Option A, packed red blood cells. PRBCs are the primary blood product used to restore circulating volume and improve the oxygen carrying capacity in clients experiencing significant blood loss and hypovolemic shock. Question 20. Now let us turn our attention to medication education for clients with schizophrenia. The nurse is teaching a client who has just been prescribed risperidone, an atypical antipsychotic. The question is, which client statement indicates the need for further follow-up and clarification by the nurse? The options are: Option A, I should report any abnormal movements that I notice; Option B, I will need to have my white blood cells checked every week while on this medication; Option C, if I develop muscle stiffness, I should notify my healthcare provider; or Option D, I can choose sugar-free gum if I develop a dry mouth while taking this medication. The correct answer is Option B, which reflects a misunderstanding. Weekly white blood cell monitoring is not required for risperidone. This precaution is specific to clozapine due to its risk of a granulocytosis. Question 21. Now let us prioritize care in a respiratory-focused scenario involving multiple clients. The nurse is caring for several clients, and the question is, which client situation requires the most immediate follow-up? The options are Option A, a client with asthma who is wheezing while receiving nebulized albuterol treatment. Option B, a client with emphysema who uses nasal cannula oxygen while eating meals. Option C, a client with pneumonia ambulating in the hallway while wearing a surgical mask. Or Option D, a client receiving oxygen via non-rebreather mask with an oxygen saturation of 92%. The correct answer is Option D. A non-rebreather mask is designed to deliver very high concentrations of oxygen, up to 95%. So an oxygen saturation of only 92%, despite the support, is concerning. It may signal worsening respiratory failure and the need for immediate intervention, such as intubation and mechanical ventilation. Question 22. Now let us explore a delegation scenario involving appropriate task assignment in a behavioral health setting. The registered nurse is working on a behavioral health unit and is delegating responsibilities to a licensed practical or vocational nurse. The question is, which assignment is most appropriate for the registered nurse to delegate to the LPN or VN? The options are Option A, conducting alcohol withdrawal, screening for a client undergoing detoxification. Option B, administering medications through a nasogastric tube. Option C, completing a suicide risk assessment on a newly admitted client. Or Option D, providing initial teaching about newly prescribed citalopram. The correct answer is Option B, administering medications through a nasogastric tube. This task falls within the LPN or VN scope of practice and is appropriate for delegation. Question 23. Now let us shift to pediatric dosage calculation, a critical area for medication safety. The primary healthcare provider prescribes acetaminophen at a dose of 10 milligrams per kilogram for a child who weighs 14.18 kilograms. The question is, how many milligrams should the nurse administer? To calculate the correct dose, simply multiply the weight by the dose per kilogram. 14.18 kilograms times 10 milligrams per kilogram equals 141.8 milligrams. Therefore, the correct answer is 141.8 milligrams. Clinically, it is essential to always double-check pediatric dosages to avoid medication errors, and many facilities require verification of weight-based dosing by a second nurse to ensure accuracy and client safety. Question 24. Next, let us focus on discharge teaching for a client managing heart failure with medication. The nurse is educating a client who has been prescribed torsemide for congestive heart failure. The question is, which client action indicates that the teaching has been effective? The options are Option A, the client plans to reduce dietary potassium intake. Option B, the client intends to record their urinary output daily. Option C, the client states they will weigh themselves daily at the same time. Or Option D, the client plans to check their blood pressure and pulse every day. The correct answer is Option C, weighing daily at the same time. This is a key self-monitoring practice for heart failure clients taking diuretics like torsemide, as a sudden weight gain may indicate fluid retention and worsening heart failure. Question 25. Now let us turn to an emergency scenario involving potential rabies exposure. The nurse is caring for a child in the emergency department who was bitten by a wild animal suspected of carrying rabies. The question is, what is the nurse's priority initial action? The options are Option A, perform a detailed wound assessment. Option B, thoroughly cleanse the wound with soap and water. Option C, obtain an order for prophylactic antibiotics. Or Option D, report the bite to local animal control authorities. The correct answer is Option B, thoroughly cleansing the wound with soap and water. This is the most effective and immediate intervention to reduce the risk of rabies transmission, as it significantly lowers the viral load at the wound site. Hey, future nurse, if you are feeling lost in your NCLEX prep, do not worry, we have got your back. This course gives you live classes, 100 hours of fun animated crash course videos, and 500 hours of recorded lessons you can binge whenever you want. You will get 500 NGN-style questions explained clearly, 5,000 actual NCLEX questions to practice, and 15 mock tests that feel like the real deal. Plus, you will get a cool NCLEX ebook, PDF notes, and study planners for 1 week, 1 month, or 3 months. And yes, you can access all of this for a whole year. So, if you want a course that makes sense and keeps you on track, this is it. Let us pass this exam together. Question 26. Now let us shift to a scenario focused on emotional well-being and client-centered care. A client awaiting diagnostic testing expresses distress about feeling unkempt and requests to wash their hair before the procedure. The question is, how should the nurse best respond to this client's concern? The options are: Option A, offer the client a cap or scarf and suggest washing their hair after testing is completed. Option B, prioritize scheduling tests and meals and assist with hygiene only as time allows. Option C, complete dressing changes and testing preparations first, then assist with hygiene. Or Option D, arrange to wash the client's hair first, then proceed with hygiene and scheduled testing. The correct answer is Option D, washing the client's hair first. This response acknowledges the client's emotional distress and supports dignity, comfort, and holistic well-being. It reflects true client-centered care by addressing personal priorities before proceeding with clinical tasks. Question 27. Now let us examine a scenario involving supervision and ethical nursing practice on a mental health unit. The registered nurse is supervising a licensed practical or vocational nurse, and the question is, which comment from the LPN or VN would most concern the RN and require immediate follow-up? The options are: Option A, I helped the client with their morning hygiene routine. Option B, I handed out the mail-in packages during morning rounds. Option C, since the client refused their valproic acid, I secretly mixed it into their breakfast. Or Option D, I am planning to participate in group activities with the clients this afternoon. The correct answer is Option C, because secretly mixing medication into a client's food without their knowledge is a serious violation of legal and ethical nursing standards. This action disregards the client's right to autonomy and informed consent, and may be considered battery. It requires immediate intervention by the supervising RN. Question 28. Let us now review a critical pediatric emergency response scenario involving basic life support. The nurse discovers a 7-year-old child in the emergency department who is unresponsive and pulseless. After calling for help and activating the emergency response system, the question is, what is the next best action by the nurse? The options are: Option A, begin 2 minutes of cardiopulmonary resuscitation with a compression to ventilation ratio of 15:2. Option B, leave the child briefly to retrieve an automated external defibrillator, then start cardiopulmonary resuscitation at a 30:2 ratio. Option C, start 2 minutes of cardiopulmonary resuscitation using a compression to ventilation ratio of 30:2 while staying with the child. Or Option D, focus on establishing intravenous access to prepare for medication administration. The correct answer is Option C, begin cardiopulmonary resuscitation at a 30:2 ratio while staying with the child. According to the American Heart Association guidelines, a single rescuer should immediately start high-quality cardiopulmonary resuscitation at a 30:2 ratio for a child, and only leave to retrieve an automated external defibrillator after 2 minutes if no one else is available. Question 29. Let us now shift to a quick intravenous infusion calculation, a vital nursing skill in clinical practice. The healthcare provider prescribes 250 milliliters of 0.9% saline to infuse over 75 minutes. The question is, what infusion rate should the nurse set on the intravenous pump? To solve this, first convert the infusion time from minutes to hours. 75 minutes divided by 60 equals 1.25 hours. Then divide the total volume by the number of hours. 250 milliliters divided by 1.25 hours equals 200 milliliters per hour. So, the correct answer is 200 milliliters per hour. Clinically, it is important to always convert minutes to hours before calculating an infusion rate. And remember that 0.9% saline is an isotonic solution commonly used for fluid replacement in cases of dehydration or mild hypovolemia. This type of question highlights the importance of precise dosing and time management in intravenous therapy. Question 30. Let us now examine appropriate infection control measures for a fungal respiratory infection. The nurse is admitting a client diagnosed with cryptococcal pneumonia. The question is, what is the most appropriate infection control measure the nurse should implement when caring for this client? The options are: Option A, Ensure easy access to a hand hygiene station near the client's room. Option B, wear a surgical mask when within 3 feet of the client. Option C, use disposable dishware for all of the client's meals. Or option D, place the client in a negative pressure isolation room. The correct answer is option A, ensuring convenient access to hand hygiene supplies. Cryptococcal pneumonia is not spread from person to person. It is acquired through environmental exposure to fungal spores, often from bird droppings, and primarily affects immunocompromised individuals. Therefore, standard precautions and hand hygiene are all that is needed. Question 31. Let us now take a look at interpreting arterial blood gas results and taking immediate action for respiratory compromise. The nurse is reviewing ABG results and identifies that the client is experiencing hypoxemia. The question is, what is the nurse's most appropriate immediate action? The options are option A, administer supplemental oxygen as prescribed. Option B, administer a benzodiazepine to reduce respiratory effort. Option C, request an order for intravenous sodium bicarbonate. Or option D, reassess the ABG in 2 hours without intervention. The correct answer is option A, administer supplemental oxygen. A low partial pressure of oxygen, or PaO2, on the ABG indicates hypoxemia, which requires urgent correction to improve oxygenation and prevent tissue and organ damage. Question 32. Now let us review emergency response during a cardiac arrest situation. The nurse is assisting during a code blue for a client who is unresponsive and pulseless. The electrocardiogram shows asystole. The question is, what is the nurse's priority action? The options are option A, prepare a sodium bicarbonate infusion to correct possible acidosis. Option B, administer intravenous epinephrine while continuing high-quality cardiopulmonary resuscitation. Option C, prepare the defibrillator for immediate use. Or option D, set up for synchronized cardioversion. The correct answer is option B, administer intravenous epinephrine while continuing CPR. In asystole, the heart has no electrical activity, making it a non-shockable rhythm. The most effective immediate interventions are high-quality chest compressions and epinephrine to support perfusion. Option A is incorrect because sodium bicarbonate is not a first-line intervention unless there is a known or suspected cause of severe acidosis. Question 33. Now let us explore therapeutic interventions for cognitive distortions, particularly catastrophic thinking. The nurse is interviewing a client who frequently verbalizes catastrophic thoughts, consistently assuming the worst possible outcome despite lacking any supporting evidence. The question is, which intervention would be most appropriate to help the client address this cognitive distortion? The options are option A, encourage the client to calculate realistic probabilities and focus on objective evidence. Option B, guide the client to evaluate people and situations along a spectrum rather than as entirely good or bad. Option C, suggest the client create a success log to reflect on past positive experiences. Or option D, recommend diversional activities such as exercise or social engagement to ease emotional distress. The correct answer is option A, which targets the core feature of catastrophizing, irrational fears, and exaggerated worst-case scenarios. By guiding the client to assess the actual likelihood of feared outcomes and consider objective facts, the nurse helps reframe irrational beliefs into more balanced thinking. Question 34. Now let us examine insulin therapy in the context of diabetic ketoacidosis, a condition that demands close monitoring. The nurse is caring for a client with diabetic ketoacidosis who is receiving an intravenous infusion of regular insulin. The question is, which client finding most suggests the development of a serious complication from this therapy? The options are option A, flushed, dry skin. Option B, nausea and vomiting. Option C, orthostatic hypotension. Or option D, blurred vision. The correct answer is option D, blurred vision. This is an early warning sign of hypoglycemia, which is a critical complication of intravenous insulin therapy and requires immediate intervention. Question 35. Now let us move on to a clinical observation scenario involving tuberculosis screening. The nurse observes a student nurse administering a purified protein derivative, or PPD, test for tuberculosis. The question is, which student action requires the nurse to intervene? The options are option A, Inserting the needle bevel up at a 15-degree angle. Option B. Informing the client that the test will be read in 48 to 72 hours. Option C. Selecting a site 3 to 4 finger widths below the antecubital space on the forearm. Or Option D. Using a 20-gauge 2-inch needle for the injection. The correct answer is Option D, using a 20-gauge 2-inch needle. This is incorrect because a PPD test is an intradermal injection that should be administered with a small needle, typically a 25 to 27 gauge and 1/2 to 5/8 inch in length. A large, long needle is designed for deeper injections and could deliver the solution into the subcutaneous tissue, invalidating the test. Question 36. Now let us review arterial blood gas interpretation, a foundational skill in critical care and respiratory assessment. The nurse reviews ABG results for a client and notes the following: a pH of 7.50, a PaCO2 of 28 millimeters of mercury, and a bicarbonate level of 25 milliequivalents per liter. The question is, how should the nurse interpret these findings? The options are Option A, metabolic alkalosis, Option B, respiratory acidosis, Option C, respiratory alkalosis, or Option D, metabolic acidosis. The correct answer is Option C, respiratory alkalosis. The pH is elevated above 7.45, confirming alkalosis, and the PaCO2 is below 35, indicating a respiratory cause. The bicarbonate level is within normal range, meaning no metabolic compensation has occurred yet. Question 37. Let us now assess early postoperative findings that may signal serious complications. The nurse is monitoring a client 6 hours after a laparoscopic appendectomy. The question is, which finding requires the nurse's immediate attention? The options are Option A, incisional pain rated 6 out of 10, Option B, temperature of 99.5 degrees Fahrenheit or 37.5 degrees Celsius, Option C, heart rate of 112 beats per minute, or Option D, hypoactive bowel sounds. The correct answer is Option C, a heart rate of 112 beats per minute. Tachycardia can be an early indicator of hypovolemia or developing postoperative shock and should prompt the nurse to assess for additional warning signs like low blood pressure or reduced urine output. Question 38. Let us now review pain management during burn care, particularly during dressing changes. The nurse is preparing to change the dressing of a client with deep partial thickness and full thickness burns. The question is, which planned action would be inappropriate? The options are Option A, administering an oral COX-2 inhibitor 30 minutes before the procedure. Option B, explaining the procedure clearly to the client beforehand. Option C, handling the burned areas gently during the dressing change. Or Option D, offering distraction techniques, such as television, during the procedure. The correct answer is Option A, administering an oral COX-2 inhibitor. This approach is inadequate for managing the intense procedural pain associated with burn care. Intravenous opioids are the recommended standard because of their faster onset and stronger analgesic effect. Question 39. Let us now focus on medication safety, particularly in clients with cardiovascular risk. The nurse is reviewing the medical history of a client who has been prescribed celecoxib. The question is, which condition would require the nurse to question this prescription? The options are Option A, osteoarthritis, Option B, gout, Option C, recent myocardial infarction, or Option D, migraine headaches. The correct answer is Option C, recent myocardial infarction. Celecoxib is a selective COX-2 inhibitor that carries an increased risk of serious cardiovascular thrombotic events, including heart attack and stroke. Therefore, it is contraindicated in clients with a recent or active history of cardiovascular disease. Question 40. Now let us examine fluid selection for a client in a life-threatening adrenal crisis. The nurse is preparing to administer intravenous fluids to a client experiencing an Addisonian crisis. The question is, which fluid is most appropriate? The options are Option A, lactated ringers, Option B, 0.9% saline, Option C, dextrose, 5% in water, also known as D5W, or Option D, dextrose, 5% in lactated ringers. The correct answer is Option B, 0.9% saline. Clients in adrenal crisis typically experience severe hyponatremia and hypovolemia. Isotonic saline directly addresses both by restoring circulating volume and sodium levels. Clinically, the preferred fluids in Addisonian crisis are isotonic solutions like 0.9% saline, or, if hypoglycemia is present, D5-NS to address both glucose and volume deficits. Question 41. Now let us focus on fall prevention strategies during a home safety assessment for an older adult with rheumatoid arthritis. The nurse is evaluating the client's bathroom environment and needs to make a recommendation to reduce fall risk and promote safety. The question is, what recommendation should the nurse provide? The options are: Option A, recommend using a handheld adjustable shower head. Option B, advise lowering the toilet seat to its lowest setting. Option C, suggest reducing lighting in the bathroom to prevent glare. Or Option D, recommend using towel racks as support bars when moving around. The correct answer is Option A, recommending a handheld adjustable shower head. This feature allows the client to bathe while seated, reducing the need for excessive movement or joint strain, both of which are critical for individuals with rheumatoid arthritis. Question 42. Now let us focus on interpreting arterial blood gas results in a client with respiratory symptoms. The nurse is reviewing ABG findings for a client presenting with dyspnea and purulent sputum. The results are pH 7.25, partial pressure of carbon dioxide 69 millimeters of mercury, bicarbonate 25 millimoles per liter, and partial pressure of oxygen 93 millimeters of mercury. The question is, how should the nurse interpret these results? The options are Option A, respiratory alkalosis, Option B, respiratory acidosis, Option C, metabolic alkalosis, or Option D, metabolic acidosis. The correct answer is Option B, respiratory acidosis. The pH is below 7.35, indicating acidosis, and the PaCO2 is elevated above 45, confirming a respiratory cause. The bicarbonate level is still within the normal range, showing that renal compensation has not yet begun. Question 43. Let us now turn to client education for heart failure management with loop diuretics. The nurse is teaching a client who has just been prescribed bumetanide for congestive heart failure. The question is, which client statement indicates that the teaching has been effective? The options are Option A, I will try to increase my daily protein intake. Option B, I will keep track of how much urine I produce each day. Option C, I will weigh myself every morning at the same time. Or Option D, I will take my blood pressure and pulse every day. The correct answer is Option C, weighing daily at the same time. This practice is the most accurate and practical way to detect fluid retention early, a key concern in congestive heart failure. Clients should use the same scale each morning, ideally after voiding. Question 44. Now let us examine safe injection practices during nursing supervision. The nurse is observing a newly hired nurse administering an intramuscular injection to an adult client. The question is, which action by the new nurse requires the supervising nurse to intervene? The options are Option A, selecting the dorsogluteal site for injection. Option B, planning to insert the needle at a 90-degree angle. Option C, cleaning the injection site with isopropyl alcohol. Or Option D, performing hand hygiene before and after the injection. The correct answer is Option A, selecting the dorsogluteal site. This site is no longer recommended for intramuscular injections due to the risk of injuring the sciatic nerve and hitting major blood vessels. Safer and preferred alternatives include the ventrogluteal, vastus lateralis, and deltoid muscles. Question 45. Let us now focus on the emergency care of a client experiencing delirium tremens, a severe form of alcohol withdrawal. The nurse is caring for a client in the emergency department who is showing signs of delirium tremens. The question is, what is the nurse's initial priority intervention? The options are Option A, assess the client's pain level. Option B, implement seizure precautions. Option C, request an order for chlordiazepoxide. Or Option D, perform a Glasgow Coma Scale assessment. The correct answer is Option B, implement seizure precautions. Clients experiencing delirium tremens are at high risk for seizures, which can be life-threatening. The nurse's immediate priority is safety. This includes padding side rails, keeping suction and oxygen at the bedside, and ensuring intravenous access is secured. As a future nurse, your time and trust are valuable, and we respect both. That is why this NCLEX course is designed to deliver results. You will receive live classes, over 100 hours of high-yield animations, and 500 hours of structured recorded lectures. We walk you through 500 detailed Nigerian NARA questions and give you access to 5,000 authentic NCLEX questions from previous exams. You will practice with 15 realistic CAT-style tests, receive an exclusive NCLEX ebook, PDF notes, and personalized study planners for 1 week, 1 month, or 3 months. With 1 full year of access, you can study at your own pace without pressure. This is evidence-based, exam-tested, and nurse-approved. Join us from link and prepare with confidence. Question 46. Let us now take a closer look at acid-base imbalances related to gastrointestinal fluid loss. The nurse is caring for a client who reports persistent nausea and vomiting for the past 3 days. The question is, which acid-base imbalance should the nurse anticipate? The options are Option A, decreased pH with elevated PaCO2. Option B, elevated pH with decreased PaCO2. Option C, decreased pH with decreased bicarbonate. Or Option D, elevated pH with elevated bicarbonate. The correct answer is Option D, elevated pH with elevated bicarbonate, which reflects metabolic alkalosis. Prolonged vomiting leads to the loss of hydrochloric acid from the stomach, causing a rise in blood pH and bicarbonate levels. Question 47. Now let us focus on behavioral responses in children following traumatic experiences. The home health nurse is assessing a child who recently relocated after removal from an abusive home environment. The question is, what behavior is the nurse most likely to observe during this visit? The options are Option A, a strong willingness to explore new surroundings. Option B, rapidly forming new social connections. Option C, improved academic performance since relocation. Or Option D, reluctance or avoidance in social interactions. The correct answer is Option D, reluctance or avoidance in social interactions. Children who have experienced abuse often appear withdrawn, guarded, or mistrustful. They may be hesitant to engage with others due to emotional trauma and fear, making it difficult for them to form relationships. Question 48. Let us now explore an important topic in obstetric care, managing unruptured ectopic pregnancies. The nurse is caring for a client diagnosed with an unruptured ectopic pregnancy, and the healthcare provider chooses a medical approach. The question is, which medication does the nurse expect to administer? Here are the options. Option A, terbutaline. Option B, methotrexate. Option C, methylorgonovine. Or Option D, nifedipine. The correct answer is Option B, methotrexate. Methotrexate is the gold standard for medically treating early ectopic pregnancies in hemodynamically stable clients when rupture has not yet occurred. It works by inhibiting the proliferation of rapidly dividing trophoblastic cells, effectively terminating the abnormal pregnancy. Question 49. Let us now transition to an essential nursing intervention in the care of clients with eating disorders. The nurse is developing a care plan for a client diagnosed with anorexia nervosa, specifically the binge eating and purging subtype. The question is, what is the most appropriate nursing intervention immediately after meals? Here are the options. Option A, encourage the client to take a walk after meals. Option B, restrict bathroom use for at least 1 hour post-meal. Option C, ask the client to lie down quietly for 2 hours. Or Option D, offer additional fluids following each meal. The correct answer is Option B, restrict bathroom use for at least 1 hour post-meal. Clients with the binge purge subtype of anorexia nervosa are at significant risk of self-induced vomiting following meals. By limiting bathroom access after eating, the nurse helps prevent purging and allows for close monitoring of any compensatory behaviors. Question 50. Let us now shift our focus to nursing delegation and appropriate task assignments for licensed practical or vocational nurses. The nurse is assigning care tasks to a licensed practical or vocational nurse. Which client assignment is most appropriate for the LPN or VN? Here are the options. Option A client in an arm cast who is suspected of developing compartment syndrome. Option B, a client immediately post-prostate resection reporting bladder spasms. Option C, a client with paralytic ileus requiring nasogastric tube insertion. Or Option D, a client newly diagnosed with hepatitis A who requires discharge teaching. The correct answer is Option C, a client with paralytic ileus requiring nasogastric tube insertion. Inserting and managing a nasogastric tube is a technical skill that falls within the scope of practice for a licensed practical or vocational nurse. It involves implementing a predetermined plan of care without requiring independent assessment, making it an appropriate delegation. Question 51. Let us now turn our attention to client education involving respiratory medications. The nurse is educating a client with chronic obstructive pulmonary disease, also known as COPD, who has been prescribed tiotropium bromide. What key point should the nurse emphasize during teaching? Here are the options. Option A, use the inhaler once daily, ideally in the morning. Option B, increase the dose if experiencing increased shortness of breath. Option C, store the inhaler in the refrigerator for optimal shelf life. Or Option D, prime the inhaler by spraying into the air before each use. The correct answer is Option A, use the inhaler once daily, ideally in the morning. Tiotropium is a long-acting anticholinergic bronchodilator prescribed for the maintenance treatment of COPD. It is intended for once daily use, preferably in the morning, to ensure consistent bronchodilation throughout the day. Option B is incorrect because clients should never adjust their medication dosage without consulting their healthcare provider, as doing so can increase the risk of side effects, such as dry mouth or tachycardia. Option C is incorrect since tiotropium should be stored at room temperature, away from heat and moisture, and refrigeration may actually damage the device. Option D is also incorrect because devices like the Respimat inhaler are primed only during the initial setup, not before every use. Question 52. Let us now shift our focus to an important clinical skill: intravenous fluid rate calculation. The healthcare provider prescribes 100 milliliters of 0.9% saline to infuse over 45 minutes. The question is, how many milliliters per hour should the nurse set on the infusion pump? To calculate this, we first convert 45 minutes into hours. Dividing 45 by 60 gives us 0.75 hours. Next, we divide the total volume to be infused, 100 milliliters, by 0.75 hours. This equals 133.33 milliliters per hour. Finally, we round this to the nearest whole number, which gives us 133 milliliters per hour. This is the correct infusion rate that should be programmed on the pump. As a clinical insight, accurate infusion rate calculations are vital for maintaining appropriate fluid balance. Overinfusion can lead to fluid overload, particularly in clients with heart or kidney issues, while underinfusion may result in inadequate resuscitation or delayed treatment response. Always double-check calculations and consider using an infusion pump with dose error reduction features when available. Question 53. Let us now shift our attention to a pediatric pharmacology scenario involving digoxin toxicity in a young child. The nurse is monitoring a 3-year-old client who is receiving digoxin for congestive heart failure. Which of the following would be the earliest sign that the nurse should recognize as possible digoxin toxicity? Options: A, dizziness; B, tachycardia; C, vomiting; D, failure to thrive. The correct answer is Option C, vomiting. Vomiting is often the very first and most reliable early warning sign of digoxin toxicity in children. It typically occurs before more serious cardiac manifestations, such as arrhythmias or conduction abnormalities, making it an essential symptom for nurses to monitor. Option A, dizziness may occur as toxicity progresses, but it is not usually an initial symptom in children and may be difficult for a 3-year-old to communicate clearly. Option B, tachycardia, is incorrect because digoxin toxicity generally causes bradycardia, not an elevated heart rate, due to its effects on slowing down the conduction through the atrioventricular node. Option D, failure to thrive, is more commonly associated with chronic, ongoing heart failure, rather than being an acute sign of digoxin toxicity. Question 54. Moving on to the next scenario, the nurse is caring for a client who is edentulous, meaning the client has no natural teeth. In order to promote safe and comfortable eating, the nurse must determine the most appropriate diet order for this situation. Here are the available options. Option A, low-sodium diet. Option B, mechanical soft diet. Option C, renal diet. And Option D, high-fiber diet. The correct answer is Option B, mechanical soft diet. This is because an edentulous client cannot effectively chew regular food textures, And a mechanical soft diet includes foods that are chopped, mashed, or ground to make chewing easier while still supporting adequate nutrition. Question 55. Let us now look at a clinical situation involving cardiovascular management. The nurse is caring for a client who is receiving an intravenous infusion of diltiazem, a calcium channel blocker. Suddenly, the client's electrocardiogram, or ECG, reveals sinus bradycardia. Faced with this change in heart rhythm, what should be the nurse's priority action? Here are the options. Option A, pause the diltiazem infusion. Option B, notify the healthcare provider. Option C, assess oxygen saturation and respiratory rate. And option D, prepare intravenous atropine. The correct answer is option A, pause the diltiazem infusion. Since diltiazem is known to lower both heart rate and blood pressure, the most immediate and effective response is to stop the infusion to prevent further bradycardia or reduced cardiac output. While it is certainly necessary to notify the healthcare provider, that action follows after removing the contributing agent. Assessing oxygen saturation and preparing atropine may be required depending on the client's response, but again, they are secondary to halting the source of the problem. Question 56. Let us now explore a clinical presentation involving post-myocardial infarction complications. A client who recently experienced a myocardial infarction suddenly develops tachycardia and begins coughing up pink, frothy sputum. The nurse must act quickly and assess the client's lung sounds. Based on these findings, which lung sound should the nurse most expect to hear? Here are the options. Option A, wheezing. Option B, crackles. Option C, raunchy. And option D, diminished breath sounds. The correct answer is option B, crackles. Pink frothy sputum is a hallmark sign of pulmonary edema, which often develops when the left ventricle fails after a heart attack. In pulmonary edema, fluid leaks into the alveoli, and as air moves through these fluid-filled spaces, it creates the distinctive crackling sound during inspiration. Question 57. Now let us turn our focus to orthopedic care, particularly involving traction therapy. The nurse is caring for a client placed in Buck's traction to stabilize a lower limb injury. To ensure the therapy is both safe and effective, which nursing action should the nurse take to support proper traction mechanics? The options are as follows. Option A, apply traction weight between 15 to 30 pounds, 6.8 to 13.6 kilograms. Option B, turn the client using a foam wedge every 2 hours. Option C, support the client's heels directly with a pillow. And option D, slightly elevate the foot of the bed to provide counter-traction. The correct answer is option D, slightly elevate the foot of the bed to provide counter-traction. In Buck's traction, which is a form of skin traction, maintaining correct alignment and counterbalance is crucial. Elevating the foot of the bed helps utilize the client's body weight to counter the pull of the traction, thereby enhancing its effectiveness. Question 58. Let us now examine a critical post-myocardial infarction scenario that highlights the importance of respiratory assessment. The nurse is caring for a client 24 hours after a myocardial infarction. Which client finding requires immediate notification of the healthcare provider? The available options are option A, elevated troponin level, option B, white blood cell count of 13,000 per cubic millimeter, option C, apprehension about attending cardiac rehabilitation, and option D, crackles auscultated to the midline lung fields. The correct answer is option D, crackles auscultated to the midline lung fields. This finding indicates possible pulmonary edema, often a result of acute left ventricular failure following an MI. Crackles at the mid-lung level suggest fluid accumulation that can rapidly progress to respiratory distress if not urgently treated. Question 59. Let us now turn to a vital laboratory and cardiac interpretation question that every nurse must master when monitoring for electrolyte imbalances. The nurse reviews a client's laboratory results and finds a potassium level of 5.6 milliequivalents per liter. Which electrocardiogram ECG change should the nurse expect to observe? Here are the options. Option A, tall, peaked T waves. Option B, ST segment elevation. Option C, peaked P waves. And option D, noticeable U waves. The correct answer is option A, tall, peaked T waves. This is the hallmark early ECG change seen with hyperkalemia, caused by altered myocardial repolarization due to excessive extracellular potassium. Question 60. Let us now examine a pediatric renal condition that requires sharp clinical judgment. The nurse is assessing a child diagnosed with glomerulonephritis. Which of the following findings requires the nurse's immediate follow-up? Here are the options. Option A, periorbital edema. Option B, decreased urine output. Option C, headache rated 9 out of 10. And option D, hematuria. The correct answer is option C, headache rated 9 out of 10. A severe headache in a child with glomerulonephritis may be an early sign of hypertensive encephalopathy, which is a medical emergency. This condition results from dangerously high blood pressure affecting the brain and can rapidly lead to seizures or altered mental status if not addressed. Question 61. Let us shift focus to a life-threatening emergency where timely intervention is critical: anaphylaxis. The nurse is teaching a group of clients about the proper management of anaphylaxis. Which statement reflects the most accurate and essential information? Here are the options. Option A, 0.9% saline should be infused once vascular access is established. Option B, intravenous diphenhydramine is the initial treatment. Option C, clients should carry pre-filled syringes of hydrocortisone. And option D, shock positioning involves reverse Trendelenburg. The correct answer is option A, 0.9% saline should be infused once vascular access is established. In anaphylactic shock, rapid intravascular volume depletion occurs due to vasodilation and increased capillary permeability. Administering isotonic fluids such as normal saline is crucial to support circulation and improve perfusion. Question 62. Let us now transition into a high-priority emergency situation involving thermal trauma. The nurse is caring for a client who has sustained full-thickness burns to the torso and back. What is the nurse's priority action in this scenario? The options are as follows. Option A, assess respiratory status. Option B, prepare an infusion of lactated ringers. Option C, insert a urinary catheter. And option D, obtain an accurate weight. The correct answer is option A, assess respiratory status. When a client presents with major burns, particularly involving the torso or upper body, airway compromise is the most immediate and life-threatening concern. Inhalation injuries can rapidly lead to edema of the airway, so the nurse must prioritize assessing the client's ability to breathe effectively and monitor for signs such as hoarseness, stridor, singed nasal hairs, or soot around the mouth. Early airway management, including preparing for intubation, may be life-saving. Question 63. Let us now shift our focus to pharmacologic monitoring in seizure management. The nurse is reviewing laboratory data for a client with epilepsy who is currently taking valproic acid. The lab results reveal a valproic acid level of 40 micrograms per milliliter, while the therapeutic range is between 50 and 125 micrograms per milliliter. So, what should the nurse do next? The options include option A, evaluate the client for non-adherence. Option B, instruct the client to skip the next scheduled dose. Option C, assess the client for valproic acid toxicity. And option D, document the result as within normal limits. The correct answer is option A, evaluate the client for non-adherence. A level of 40 micrograms per milliliter is considered subtherapeutic, which puts the client at increased risk for seizure breakthrough. The first step the nurse should take is to evaluate whether the client has been taking the medication consistently, as missed doses are a common reason for decreased drug levels. Option B is incorrect, because skipping the next dose would further lower the drug level, heightening the risk for seizures. Option C is also incorrect, because the level is too low to be associated with toxicity, which typically occurs when levels exceed 125 micrograms per milliliter. Option D is incorrect because the nurse should not document a clearly subtherapeutic level as within normal limits. Doing so could result in unsafe continuation of the current regimen. Question 64. Let us now take a closer look at intravenous insulin calculations, a critical skill for safe medication administration. A client is prescribed regular insulin at a rate of 4.5 units per hour. The solution available contains 100 units of insulin, diluted in 250 milliliters of 0.9% saline. The nurse needs to calculate how many milliliters per hour should be infused. Here are the options. Option A, 9.2 milliliters per hour. Option B, 11.3 milliliters per hour. Option C, 6.4 milliliters per hour. And option D, 13.8 milliliters per hour. The correct answer is option B, 11.3 milliliters per hour. Let us walk through the calculation. The concentration is 100 units in 250 milliliters, which equals 0.4 units per milliliter. To determine how many milliliters deliver 4.5 units per hour, divide 4.5 by 100 to get 0.045. Then multiply 0.045 by 100 to get 0.045, 250 milliliters, which equals 11.25 milliliters per hour. Rounding to one decimal place gives us 11.3 milliliters per hour. This precise titration is vital when administering insulin intravenously, as both underdosing and overdosing can result in dangerous hypo or hyperglycemia. Always double-check the math and programming of the infusion pump to ensure safe, effective insulin delivery. Question 65. Let us now focus on a key indicator used to monitor response to fluid resuscitation in a client with septic shock. After administering intravenous fluids, the nurse needs to determine whether tissue perfusion has improved. The question is, which laboratory value best evaluates the effectiveness of fluid resuscitation? Here are the options. Option A, serum troponin. Option B, serum glucose. Option C, serum white blood cell count. And option D, serum lactic acid. The correct answer is option D, serum lactic acid. Lactate is a byproduct of anaerobic metabolism and rises when tissues are poorly perfused. During septic shock, elevated serum lactic acid levels reflect hypoperfusion and cellular oxygen deprivation. When effective fluid resuscitation is initiated, improved tissue perfusion reduces anaerobic metabolism, causing serum lactate levels to decline. Ready to pass the NCLEX without wasting time? Let us get straight to the point. This course gives you 100 hours of animated crash classes, 500 hours of recorded lectures, and 500 Nigerian Naira questions broken down in detail. You will also get 5,000 past NCLEX questions, 15 CAT mock tests, an exclusive ebook, PDF notes, and study planners that fit your timeline, whether it is 1 week or 3 months. And yes, you get 1 year of access after enrolling. This is not just a course, it is your complete NCLEX prep solution, so do not wait. Go to website now and start preparing like a future RN. Question 66. Let us now explore a critical aspect of caregiver education for a child with a ventriculoperitoneal (VP) shunt. When a caregiver expresses concerns or asks questions, it is essential for the nurse to recognize which statements demonstrate appropriate understanding of potential complications. So here's the question. Which caregiver statement indicates proper understanding of VP shunt complications? The options are: Option A, we should expect frequent nosebleeds. Option B, we need to monitor for abdominal distension or discomfort. Option C, the child may have increased thirst and urination. And option D, it's normal for swallowing to be difficult after shunt placement. The correct answer is option B, we need to monitor for abdominal distension or discomfort. This is correct because a VP shunt drains excess cerebrospinal fluid into the peritoneal cavity, and abdominal discomfort or distension may signal a complication such as peritonitis or shunt malfunction. It is a critical red flag that caregivers must be taught to recognize. Question 67. Let us now turn our attention to a key teaching moment for clients newly prescribed rapid-acting insulin for type 2 diabetes mellitus. Understanding the timing of insulin administration is critical to prevent complications like hypoglycemia. So here's the question. Which teaching point is appropriate when educating a client about rapid-acting insulin? The options include option A, once you open your vial of insulin, discard it 25 days after opening it. Option B, inject yourself with this insulin 20 to 30 minutes before meals. Component placement. Option C, you can inject yourself with this insulin while you are actively eating. Component placement. And option D, this insulin is administered right before you go to bed to minimize overnight blood sugar spikes. The correct answer is option C, you can inject yourself with this insulin while you are actively eating. This is because rapid-acting insulin, such as insulin Lispro, Aspart, or Glulisine, is designed to begin working within 10 to 15 minutes. So administering it at mealtime helps align the insulin's peak action with the glucose absorbed from food, thereby reducing the risk of hypoglycemia. Teaching clients to inject rapid-acting insulin right at mealtime or while eating is essential to matching insulin action with food absorption and avoiding dangerous blood sugar drops. Question 68. As we explore early prenatal care, it is important to understand what assessments are appropriate during the very first visit. So here's the question. A newly pregnant client is at her first prenatal visit, 3 days late for her period, and asks about upcoming assessments. Which test is not typically done at this stage? The options are Option A, calculation of body mass index, BMI. Option B, evaluation for edema in hands, face, and ankles. Option C, fetal Doppler assessment, and Option D, pelvic examination. The correct answer is Option C, fetal Doppler assessment. At this very early point in pregnancy, only days after a missed period, it is far too early to hear fetal heart tones using a Doppler device. These tones usually become detectable between 10 to 12 weeks of gestation, when the fetal heart is large and strong enough to be picked up through the abdominal wall. In summary, fetal Doppler assessment is not done this early, making it the correct answer for what is not typically included in the first prenatal visit. Question 69. Let us now turn our attention to a high-risk medication that requires careful monitoring. Here is the question. A client taking lithium for bipolar disorder presents with vomiting, diarrhea, blurred vision, and a lithium level of 2.5 milliequivalents per liter. What condition does the nurse suspect? The options are Option A, lithium toxicity. Option B, allergic reaction to lithium. Option C, normal reaction to lithium. And Option D, lithium level is too low. The correct answer is Option A, lithium toxicity. A lithium level above 1.5 milliequivalents per liter indicates toxicity, and a level of 2.5 milliequivalents per liter is significantly elevated. At this level, classic symptoms such as nausea, vomiting, diarrhea, blurred vision, tremors, and even tinnitus can occur. This is a medical emergency and must be addressed immediately. On the other hand, Option B is incorrect because an allergic reaction typically presents with symptoms like rash, itching, or anaphylaxis, not gastrointestinal or neurologic symptoms. Option C is incorrect as these symptoms are far from normal and actually suggest serious toxicity. Option D is also incorrect since the lithium level is clearly elevated, not low. In summary, any signs of lithium toxicity must be reported and managed without delay, often requiring interventions such as intravenous hydration or dialysis in severe cases. Question 70. Shifting our focus to the topic of sexually transmitted infections, here is a question assessing your ability to recognize classic signs of syphilis. A nurse is evaluating a female client suspected of having syphilis. Which finding best supports this diagnosis? The options are Option A, dysuria. Option B, vaginal discharge. Option C, chancre lesion. And Option D, dyspareunia. The correct answer is Option C, chancre lesion. A chancre is a hallmark of primary syphilis, typically presenting as a firm, round, and painless sore at the site of infection. This lesion often goes unnoticed due to the absence of pain, but is the most specific indicator in the early stage of the disease. Always remember, early detection and treatment of syphilis are critical, and it must be reported to public health authorities to ensure proper contact tracing and prevention of disease progression. Question 71. Let us now turn our attention to recognizing serious complications in congestive heart failure. The nurse is caring for a client with congestive heart failure who is experiencing an exacerbation. Which vital sign finding indicates a complication of heart failure? The options are Option A, decrease in blood pressure. Option B, increase in temperature. Option C, decrease in respiratory rate. And Option D, increase in blood pressure. The correct answer is Option A, decrease in blood pressure. A declining blood pressure is a significant red flag in congestive heart failure, suggesting the heart is failing to maintain adequate cardiac output. In early exacerbations, the body may compensate with increased blood pressure, but as the heart decompensates, this compensation fails, leading to hypotension and signs of impending cardiogenic shock. Always remember, in any CHF client, a drop in blood pressure combined with signs of poor perfusion, like cool extremities, confusion, or reduced urine output, requires urgent attention to prevent further clinical deterioration. Question 72. Moving into our next scenario involving abdominal assessment, Let us consider a client with suspected acute cholecystitis. The nurse is evaluating this client and must determine which clinical finding best supports the diagnosis. The options are: Option A, decrease serum bilirubin. Option B, increase high-density lipoprotein cholesterol, HDL-C. Option C, decrease serum aminotransferases. And Option D, increased white blood cell count, WBC. The correct answer is Option D, increased white blood cell count. This is because acute cholecystitis is an inflammatory process of the gallbladder, and inflammation typically leads to an elevated white blood cell count. This lab result often accompanies hallmark symptoms such as right upper quadrant abdominal pain, fever, nausea, and vomiting. Now looking at the incorrect options, here is your clinical insight. Do not forget about Murphy's sign, which is pain during deep inspiration when palpating the right upper quadrant, a classic physical exam finding in cholecystitis. Question 73. Let us now examine a high-risk trauma scenario where swift clinical judgment is critical. A nurse is caring for a client who has fallen from a ladder and now reports numbness in the legs. What should the nurse do first? The options are: Option A, assess the client for lacerations. Option B, evaluate the range of motion of the client's neck. Option C, provide cervical spine stabilization. And Option D, assess the range of motion of the lower extremities. The correct answer is Option C, provide cervical spine stabilization. When a client presents with potential spinal trauma, especially following a fall with neurological symptoms like leg numbness, immediate cervical spine stabilization is the top priority. This action prevents further spinal cord injury, which could otherwise lead to irreversible damage or paralysis. Clinical Pearl: in any trauma situation with suspected spinal involvement, always assume the cervical spine is unstable until it is cleared by imaging. Question 74. Moving on to a case involving gastrointestinal discomfort, a client reports excessive flatulence and abdominal cramping. The nurse anticipates administering which medication to alleviate the symptoms? The correct answer is Option A, simethicone. Simethicone is an anti-foaming agent that works by combining small gas bubbles in the stomach and intestines into larger ones, making them easier to eliminate through belching or flatulence. It is commonly used to relieve uncomfortable bloating and gassiness. Option B, omeprazole, is incorrect because it is a proton pump inhibitor used to suppress gastric acid in conditions like gastroesophageal reflux disease and ulcers. It does not address gas-related symptoms. Option C, ferrous sulfate, is also incorrect, as it is an iron supplement used for anemia, and in fact, it can worsen gastrointestinal issues by causing constipation and gas. Option D, cimetidine, is another incorrect choice. Although it reduces stomach acid as an H2 blocker, it does not provide relief from flatulence or intestinal gas. See the Clinical Pearl. Alongside simethicone therapy, clients should be educated to avoid gas-producing foods such as beans, cabbage, and carbonated beverages to minimize recurrence of symptoms. Question 75. Moving forward to our next critical concept, the nurse is assessing a client with suspected retinal detachment. Which manifestation is not consistent with this diagnosis? The options are: A, seeing floaters in the field of vision. B, a sense of having a curtain drawn over the eye. C, flashes of light. Or D, intense pain in the affected eye. The correct answer is Option D, intense pain in the affected eye. Retinal detachment typically presents without pain. Clients commonly describe visual symptoms such as sudden floaters, flashes of light, or the sensation of a dark curtain or shadow moving across the visual field. These visual disturbances result from the retina pulling away from the layers underneath. Therefore, Option A, floaters, Option B, curtain-like vision loss, and Option C, light flashes, are all consistent signs of retinal detachment. However, Option D, intense pain, is not expected and may instead suggest conditions like acute angle closure glaucoma, which is painful. As a clinical pearl, remember that retinal detachment is a medical emergency requiring immediate ophthalmologic intervention to preserve vision. Thanks for watching. See you in next video.